Dr. Ahles here. In this short video, we're going to talk about the recipe or the chemicals that you need if you were trying to build bone tissue. When we talk about bone tissue, recognize that it's made of things that are both organic and inorganic. Now, it's been a minute since we talked about what organic means in science, but remember that the word organic means something that contains carbon. So when we're thinking about the organic component of bone tissue, we're talking about a protein called collagen. Collagen is a protein that makes up the scaffolding of bone tissue. So the analogy I like to give for bone tissue is think about the concrete that's used to build a sidewalk. Before that concrete is poured, we put down metal called rebar. That's what collagen is. It's the shape of or the strength of my bone tissue. The function of collagen is to make something called sacrificial bonds. And when we talk about a sacrificial bond, this is a kind of chemical bond that can break without causing the entire bone to break or the entire bone to shatter. So let's take a look at our picture over here to explore sacrificial bonds. Notice here on the left, I've got a region of my bony tissue with lots of these little sacrificial bonds. They're shown here in X, as X's. When there's some kind of trauma, some kind of impact, notice that some of my connections between these collagen proteins have been severed, leading to a little bit of spacing out. By the end of that pressure, that traumatic event, almost all or a very large number of those bonds have been broken. But those bonds have broken, the entire bone itself has not shattered. So by using these sacrificial bonds, we give our bone what we call tensile strength, meaning we can put tension on it and it's not immediately going to shatter. It can have a little bit of twisting, turning, pulling, and still be okay. That's the job of my organic component of bone tissue, my collagen proteins. Compare that to my inorganic component, the one that doesn't have carbon inside of it. That's hydroxyapatite, or the easy person word for hydroxyapatite is calcium phosphate. The goal of the calcium phosphate or the hydroxyapatite in bone tissue is to make your bone very hard and make it very durable. To go back to our example of pouring a sidewalk, the inorganic components of bone are the concrete that goes over the rebar. The rebar is collagen, the concrete is hydroxyapatite. With these two components, our bone tissue is very strong and it's less likely to break.